Hi, it's Austin Docherty here, and I'd just like to run through a very short ankle and foot examination that I would do in my general practice. The first thing that I would do with the assistance of my colleague here is I would inspect with the patient standing. We're looking for any signs of hallux valgus, pes planus, pes cavus. We would look posteriorly and look for anything such as thickening of his Achilles tendon. We would ask the patient to walk. Can you walk up, please? And we're looking for any pronation, supination, or any problems such as that. If we were worried about pes planus, we can get the patient just to stand on their tiptoes, and that would normally, if they have pes planus in a normal patient, that would go once the patient stands up. The next thing that we would do is we would get the patient to lie down. Would you mind lying down for me, please? And again, we inspect. We're looking for any areas of hard skin. We're looking for any signs of any muscle wasting or any trauma. And we'll check the nails to make sure there's no fungal infections. And then once we've inspected, we then move on to range of movement. There's 4 ranges of movement at the ankle joint that we're interested in. We're interested in plantar flexion, dorsiflexion, eversion and inversion. So we would test that actively and passively. If we just to demonstrate, would you mind lifting your foot up for me? Would you mind pushing your foot down? Okay, that's fine. Can you move your foot to the side? So inversion and now eversion, that's fine. So we've got a range of movement there, and we'd also check his big toe, and we would check for plantar flexion and dorsiflexion. Would you mind moving your big toe up? Just your toe. That's it. Okay, and then push your big toe down. Okay, that's fine. I would also check against resistance for all those movements, okay, but time constraints won't allow that. So we've checked the range of movement, so we're happy with that. We then move on to palpation, and what we're looking for is any evidence of any tenderness anywhere. I would usually start by checking his pulses, his dorsalis pedis pulse, which is just lateral to his extensor hallucis longus tendon. I'd also check his posterior tibial pulse just to check that they're okay. We then move on and we'd palpate his bony structures. We'd palpate both malleoli to see if there is any tenderness. We might palpate the navicular, which is around this area here, and also the cuboid. We would palpate, we'd check his mid-tarsal range of movement. We'd check his subtalar range of movement. And we'd also squeeze his metatarsal heads to check for any metatarsalgia. Following this, once we've established that there is no bony tenderness, we'd move on to the specific ankle ligaments that we might be interested in. In the ankle there are lateral ligaments, medial ligaments and Achilles tendon, and of course a syndesmotic ankle sprain that we need just to check. The first thing that we would check for is his ATFL, which is his anterior talofibular ligament, which normally sits in this area here. This is where the patient will complain of pain. The test that we would do in this case is to do an anterior draw test. An anterior draw test is one where we would apply. Are you okay? We can move you around with your feet round here. Okay, just relax for me. Anterior draw test, what we would do is we'd grab his distal leg, we'd hold his calcaneum, and then we'd just apply pressure, just bringing my right hand anteriorly. What we're looking for is any 5mm deviation or above, which may indicate that we have a problem with his ATFL. If there is a problem with his ATFL, he'd usually complain of pain in that area as well. There's another test that we can do for his lateral complex is to check for a talar tilt, and a talar tilt we can check the 3 elements to the lateral complex. Just relax for me, that's fine. So we'd grab his foot there, and what we're looking for is to apply pressure to his ligaments. Now, to test for his ATFL, we would have his foot in plantar flexion, and we would just tilt his foot like this. We'd ask him if he has any pain. Have you got any pain when we do that? That's fine. That tests his ATFL. To test his CF, his calcaneofibular ligament, we would put his foot into a neutral position and again apply a talar tilt, which would tell us if there was any problems with his calcaneofibular ligament. To test his posterior talofibular ligament, we'd dorsiflex the foot and again apply a talar tilt. Any pain would tell us whether or not there was a problem with that complex. Two more things that we would need to test for. If we want to test for his deltoid ligament, his medial ligament, what we would we can do a test called a Kliger's test, and this applies pressure to his deltoid, and again a positive test would indicate pain over his deltoid ligament. And the way that we do this is, again, just relax for me, I'm just going to move your foot, I'm just going to evert his foot whilst his foot is just in plantar flexion, and that puts pressure on his deltoid. Any pain as I do that? That's fine. So that would indicate if there was a problem in that area. If we were worried about a syndesmotic ankle sprain, there are two tests that I would do to test for that. The first is a variant of the Kliger's test, which is what we've just done for his deltoid. We would put his foot into a dorsiflex position, and then we would just apply pressure again over this area, evert the foot. If he has a syndesmotic ankle sprain, he would tend to complain of pain in this area. We can also test for a syndesmotic ankle problem by doing a thing called a squeeze test. And the way that we do the squeeze test is we put our hands around his tibia and fibula heads and we squeeze, and then we gradually move down his leg towards his ankle, asking for any pain. The lower the area of pain that he experiences, the lower the syndesmotic ankle sprain would be. So we've tested his lateral ligaments, we've tested his medial ligaments. What we would look for now is to test his Achilles tendon. And for his Achilles tendon, what we would do is a thing called the Thompson's test. We get the patient to lie on their stomach, if you just lie there for me, and then we'll just get you to flex your leg to 90 degrees. And what we do here is we squeeze his calf and we watch movement in his foot. A positive test is where there's no movement, and that may indicate that there is a tear of his Achilles tendon. So a negative test, we'd see some movement. So as I squeeze his calf, we see his foot move, which indicates a negative Thompson test. That concludes my foot and ankle very brief examination.